Have you been told you're heavy-handed when it comes to your dental hygiene instrumentation? Usually it's because you're not adapted enough. So when we instrument, especially with a curette, something with a toe like this, I really want to make sure just the last tip third is on the tooth. So as I'm instrumenting this distal, I pretty much want the back of my instrument where it bends touching the opposite tooth. And that'll make sure I have the last 3 millimeters, 2 to 3 millimeters of the cutting edge on the tooth. Usually, if we're not adapted correctly and I'm going interproximally, I'm going to be just poking interproximally into the gingiva and not touching the tooth at all. So as I roll a little bit more, I can really get interproximally and sub better. If I'm trying to force it in there, it's usually not adapted enough. So keep that in mind as you're rolling and adapting. You might have to just go a little bit more for this instrument to naturally fall in there. The goal is the instrument to fit because they're made to. There's a natural space there and they should roll in there naturally. Now, if a person has infection or disease, it's gonna hurt, right? If you cut your hand and you clean out your infection, it hurts. Gums are gonna hurt. No matter how well you're adapted, it will be tender if the patient has infection. So at that point, we need to look at some other options like anesthetic or topicals or things. But if it's a typical healthy patient, make sure you're adapting enough so then the patient can't feel the instrument.